Hey Bonnie, I just wanted to hop on here right quick and talk about the topic of why physical therapy offices will discharge a client even though that client is doing everything right, working really hard, and they are still having symptoms. Bonnie brought an excellent point on this video where I played out that scenario. A patient was asked to discharge from therapy even though they were still having symptoms due to a plateau, which is what's going to happen to the patient now? And I feel bad for her. I feel bad for her too. In reality, that scenario that I played out, I simplified it so that the video would be more palatable and 1 minute long. And every physical therapist will tell you that's actually a common thing that happens multiple times per year in every physical therapy practice to every single physical therapist. There are a ton of reasons why that might occur. Let me throw out a few scenarios. First, let's talk about incurable things like incurable injuries that are always going to be present or incurable diseases or disorders. So let's say a teenager comes in with a spinal cord injury, incomplete spinal cord injury, where they are partially paralyzed from the waist down. Their legs are now spastic and weak. They can no longer run, jump, cut. Their life is going to be spent in a wheelchair. However, their legs still move. Their legs are still under their control, but not near as much as they used to, and they're not as strong as they used to be. In physical therapy, following the injury, you'll spend months trying to see what you're going to get out of these legs, because sometimes healing does occur, and you'll walk that person every single day, and really hope for the best. And it is absolutely gut-wrenching when you finally have to tell this person, we tried our best, but the wheelchair is going to be your life, and you knew that from the outset. Scenario 2. Let's say you have a client come in with severe hip arthritis. Arthritis is just medical code for there's no cartilage left. The joint has a lot of wear and tear. The ligaments have tears. The muscles have severe limitations that are structural due to the joint having arthritis. The patient might come in not being able to stand up out of a low chair. The patient might come in not being able to stand or walk for very long, and they have severe pain in the joint. Well, physical therapy might get them to the point where they can now stand and walk enough to live their daily life. Maybe they're not running marathons, but they can get out of low chairs at the doctor's office. They can walk to the mailbox and back, and they're having very minimal pain. Sometimes the patient's expectations need to be tempered because they have reached a plateau point where they can now function. But the only other option here is to go back to the doctor and ask for either an injection or a joint replacement. That might be their only option at this point to get completely pain-free. In the dizziness realm, there are a lot of incurable vestibular diagnoses that the patient needs to manage long-term for the remainder of their life. Examples of those would be Meniere's disease or vestibular migraine. And that's something you would have said, or I would have said, any good therapist would have said on day one. With this diagnosis, we're going to probably get you to a plateau point, and then you will have the tools to be able to manage these symptoms forever. However, do expect to have some residual dizziness and flare-ups. Even though we can improve you a lot functionally and symptom-wise, you might just get to a plateau point. My point is, every single patient is different, and there are scenarios where it is completely expected that the patient is going to reach a plateau with physical therapy without full resolution of symptoms. And if that were the case, this video, if it were a real person, those details would have been included in the explanation during the discharge, and the patient would have been well aware of these limitations from the outset. But it is a common scenario where the physical therapist has many hours down with this patient, has educated the patient, has spent many weeks and months doing everything right with this patient, and the patient's doing everything right as well. And you get to the point where you tell them, it is my professional opinion that you can no longer make any more progress, and I think this is the end of the road. You can try another therapist if you want. You can go to a doctor, and you have these X, Y, and Z options to discuss with your doctor. Those specific things would be discussed with that person at the time of discharge. And then the doctor somehow still overrides you and sends a referral back for the same diagnosis, even though you thought the patient understood what you were trying to say. And it's really not up to the doctor if the patient receives more physical therapy from you. So it's a frustrating thing from both ends, I agree. And the video just scratched the surface that situation exists. So I just wanted to hop on and explain that there are nuances, that there are special situations, and that it doesn't go down exactly like that video was portraying it to go down. And thank you, Bonnie, for your question. It is a valid question and a good question, and sorry this video was so long.